Good morning, and welcome to the Health Leaders AI Now Online Summit. My name's Eric Wicklund. I'm the senior editor for innovation and technology here at Health Leaders, and I am the moderator for today's event. This is the final session, the second session in a two-panel AI Now event. We had a wonderful discussion earlier on this morning about the use of agentic AI in clinical care, and it was a great way to set the tone, and it kind of works perfectly as it goes into this panel, which I am excited to talk about. There's a lot here that is being done now, and there's a lot of potential in this particular area right now too. This session of our event is titled Expanding Opportunities for AI in Patient Engagement. Thank you to our audience for participating in today's summit and joining this final session. Before we get started, I do have a few housekeeping details. This program is going to be 60 minutes in length. Note that an on-demand version of the program will be available approximately 1 day after the completion of the event, and it can be accessed using the same link that you used for this program. To ensure that you see all the content for this event, please maximize your event window and be sure to adjust your computer volume settings and or speakers, PC speakers, for optimal sound quality. Next, you'll find a resources list for today's webinar in the upper right corner of your screen. Here we've listed the program's slide deck and supplemental resources that you can interact with. At the bottom of your console are multiple widgets that you can use to submit a question, and we will have a Q&A session at the last 15 to 10 minutes of this program. To submit a question, please click on that widget, that Q&A widget. Please note that you can ask questions at any time, but please note that they likely won't be answered until that final Q&A part of this program. Finally, should you experience any technical difficulties, and we've certainly had our share of those lately, during today's program, and you need assistance, please click on that help widget, which is a question mark icon and covers common technical issues. Now, at this time, I really want to get into the fun part, the discussion. I have a wonderful panel here. At the moment, I have two panelists. I do hope that we will get a third panelist shortly. He should be coming on at some point, hopefully. With us today right now are Stacey Johnston, Chief Information Digital Execution Officer at Beacon Health, and Roopa Foulger, Vice President of Digital and Innovation Development at OSF HealthCare. We got both Midwest health systems today, which I like. I do have Michael Maniero, Chief Digital and Information Officer at Catholic Health in Long Island, invited. We will see if he joins us. Hopefully he will. And with that point made, let me jump on to our first question here. And it's basically just to give the two of you a chance to introduce yourselves to the audience, and maybe just give us a few quick words on how you see AI impacting patient engagement. I'll start with you, Stacey.
Sure. Hi, I'm Stacey Johnston. I'm here at Beacon Health System. It's an 11-hospital system based out of South Bend, Indiana, and we're in the Michigan market, Indiana market as well too. I've been here about 1.5 years. So my background is I'm actually a physician. I came up through the ranks of becoming a CMIO, leading several implementations, everything from Meditech to Cerner to Epic and now Oracle. So I've had my gamut of experiences of different EHRs. And so I think having that clinician insight has helped me understand, the workflow processes, operational needs, and of course the patient experience, which is why I'm so happy to be here. So Beacon, we've done a lot with our, patient experience, and we have a whole team dedicated to the consumer, the digital front door, the omni-channel approach that we've always talked about. And so really happy to partner. So IS had not necessarily had that same partnership or relationship. And so now we're working together in this idea of becoming a digital first organization. So the digital front door, that marketing team is closely working with the IS team, and that we're creating that seamless integrated experience for both the patients and for the providers in this ideal that we're striving for is to become, again, a digital first organization. So happy to be here.
Great. Okay, Roopa.
Roopa Foulger, I'm VP of Digital and Innovation Development at OSF HealthCare. OSF HealthCare is a faith-based Catholic organization that is in Illinois and Michigan. We have over 18 facilities. And my work sits at the intersection of clinical operations, technology, and innovation. And um, my team and I, we focus on implementing or building what we call as adjacent and breakthrough innovation. So part of it is also very research oriented. And we partner very closely with care teams, IT, as well as marketing, because we're talking about digital front door and patient engagement, as well as On Call, which is our digital health division that is much broader, not just the front door, but also digital care and other aspects. And a big part of what I focus is designing sustainable architecture that supports not only patient engagement, care coordination, and emerging AI capabilities. At the core, I'm passionate about using technology to reduce friction in healthcare and create more meaningful, connected experiences between patients and clinicians. As far as technologies and capabilities that we've implemented more on the digital front door, we have been, as I said, collaborating with IT, marketing, as well as our digital health, and we put in a number of solutions and systems in place. Starting even before COVID, so it's we've had some maturity learning through it. Right, there's just so much changes happening, and finding in continuously improving on the experiences for our patient is something important at OSF, and we're constantly innovating in that space.
Great, thank you. So much is being invested in the digital front door, and the idea that you need a smoother experience for patients entering the health system. There have been some recent surveys that have indicated amongst the C-suite, the healthcare C-suite, patient engagement, patient activation is a chief concern, and one that AI can hopefully address. Now, with that in mind, I'm going to ask this first question. I'm going to start with Roopa on this: is how are you using AI to enhance that digital front door, that patient portal?
Yeah, so if we have a significant team and implementation more on the digital front door, whether it's a front door through our website, and we have a digital experience platform, whether it's an app, a mobile-based app, that is connected with MyChart. We are an Epic shop, so it's a very layered approach, even in the patient portal. And what we take into account is the personalization aspect too. There are patients that prefer coming through the portal or through an app. There are patients that just prefer, through chat, or there are patients that just prefer, having a conversation through our, call center team or through our clinical offices. So there are a number of ways, factoring in personalization, smart intake and triage, whether it's, having a chat bot that connects to a person on the other end, whether it's a virtual nursing team. So that's one aspect, or we're just doing more proactive outreach, connecting to the patients, or more automated content summarization through the proactive outreach, or even after post visit, seeing how we can connect with them and optimize the experience through our digital care teams. So there are so many aspects in how we are, leveraging AI, leveraging, content in connecting with our patients. And the portal is one, the front door is I guess, one more modality in how we connect with them.
Okay. Stacey, same question. How are you using AI to enhance your patient portal?
Yeah, so great question. So we are an Oracle partner, and we actually just signed our One Beacon Oracle agreement and the beta partnership with Oracle. So on Oracle's roadmap is an enhanced AI patient portal, and we are looking to transition in the second half of 2026. In the meantime, what we have had is our patient portal is our foundational Cerner portal, and then we've layered on some AI components on top of that to really double down on our outreach and the ability to schedule off of orders, off of care gaps. And so really partnering with we use Notable and we use Salesforce. And then we've actually coupled in with some other AI modalities for additional outreach around radiology and imaging. And so it's kind of this large wraparound of AI on top of our portal, whereas we don't have fully integrated AI into our direct portal quite yet, but that is on our roadmap for 2026. So one of the things that we're really focusing in on, again, is doubling down on the ability for the patient to self-schedule. And so moving towards order-based scheduling in the radiology space, which then triggers the ability of the AI to alert the patient, gives them multiple times to choose from based off of their insurance, based off of their preference, their location. So taking all of that information and then queuing up some potential opportunities for scheduling. Then once they schedule, they get the reminder. What's nice is that the AI is also built into the reminder so that should they need to reschedule or pay their bill or do anything wrapped around that service, they can all do that within the text message. So you can actually reschedule your appointment from within the text message alone. And then it takes it back into that Notable framework, but the patients are only seeing that it's a text message to them, and that what's really built behind the scenes is this Notable layer on top of our Oracle core patient portal.
Great. Okay. It seems that, excuse me, patient engagement, patient portals are kind of the next wave of how AI is being deployed. We've seen it so far begin with administrative, operational, revenue cycle management, especially, has seen some early successes with AI. Now everyone's talking about ambient AI and capturing the doctor-patient conversation. Clinical care is starting to see the benefits. Patient engagement is kind of a new area, and it sounds like a lot of health systems are just getting into that now, or just exploring it now. So it's interesting to see where this will go from here, how you plot that trajectory into platforms that work directly with the patient. With that in mind, this next question talks a little bit about the challenges you expect you're seeing, or what are the challenges you're facing in using AI to improve that connection with the patient. Stacey, let's start with you on this one.
Sure, that's a great question. So as I mentioned at the beginning of the session, I'm a physician, and so workflows are just ingrained into everything that I do. And so I always come back to what problems are we trying to solve. So having that informatics background, so you need to identify your problems first, and then you need to identify workflows and standardize around those workflows. What you don't want to do is take the technology, deploy it, and say, okay, we've built it based off of multiple different workflows. That's just never going to work. Or where you try to build the technology around old processes. And so you really need to take the technology as it's best built and best utilized, and then build your workflows around that. And in the process, you also need to standardize and train to those standardized workflows. And so without doing that pre-work, that heavy lift ahead of time, the technology will always fail. And so, we've seen that, multiple times here at Beacon and other places I've been, where we try to implement based off of, prior processes or not standardized intakes. And then we have to go back and continually optimize or continually try to standardize post-implementation. So I think that's my biggest piece of advice is, working with your clinicians, working with your operational folks, to have them at the table when you're designing your systems so that everyone understands the workflow. So an example of this, again, is with Notable. When we first started doing the orders to schedule, we didn't have standardized orders and we didn't have standardized templates. And so we ended up delaying our implementation 6 months to at least so we ended up limiting our scope and really try to double down on standardizing the orders and standardizing the templates so that the tools could actually work as intended. And then once we realized that was our process, we then ended up having to build our scope a little differently, which was the first body of work is standardizing your orders and templates, and then we're going to build the notable on top of that instead of the other way around. So it's just, it's an example of where, operational clinical folks have to be at the table before we can really start to deploy some of these AI initiatives.
A good lesson for health systems just getting into this now, and there are a lot of them out there that are. And really, it doesn't have to, you can be on any EHR platform. The idea that you have to create, you have to develop standards, standardization before you really get into the meat and potatoes of it. I think that's something that maybe a lot of health systems don't realize when they start this journey, and that's something they should do. Good. Roopa, OSF HealthCare has done a number of things in this area. What are the challenges you're using or you're seeing in developing and implementing this technology?
I think Dr. Johnston made an excellent point about workflow alignment. So again, it's so critical. It's not only about improving the patient experience, but as long as it doesn't create a burden for clinicians, right? I think that's very critical. What I want to add on to that is, and this is lessons learned for us over the years, so workflow alignment with the experience, right? So it's so important from, bringing in a thinking out of a human-centered design experience, like the area, the workflow, and the location where the clinicians are working, and all that matters, and how some of these, technologies integrate operationally. So what we've now started doing the last couple of years, actually, we have a team of UX as well as human-centered designers that collaborate with us as whether we are implementing or building, kind of observing the workflow and giving another view in how the technology should really integrate within the workflow. So besides the clinical operations, this is another aspect that we're bringing in. And I want to add another item too from a challenges perspective is the data fragmentation. I think we have a lot of technologies that's awesome, and there's so much change that's happening, which is all good, right, from a technology. But the foundation for AI is so much on the data side, and I see a lot of data fragmentation that whether it's the scheduling connects to the care management, connects to the revenue cycle, right? So I think that is important that healthcare in general needs to start addressing that. How do we unlock this data, reduce the data fragmentation, because that feeds so much onto the AI layer. And from a patient experience standpoint, there's so much technologies depending on the journey that the patient is, right? So strengthening the trust the patients have with these technologies. In fact, I don't think they should even know that this is a notable, or this is another vendor that we're working. It should be like this is from the system and healthcare system. This is representing OSF, and strengthen the verification and the governance aspect. I think those are all solvable things that we need to start thinking about and improving on that experience, the virtual front door experience for both the patients as well as in the clinicians on the other side.
Yeah, two good points there.
I think that's a great call out about the data. And I think having a robust data cleanup approach makes a lot of sense, that, bad data in is bad data out. And then what you don't want to have is that something then triggers an alert to the patient where they say, well, no, that appointment is canceled already, or I've already moved it, but they just got a reminder about, so making sure that you understand, how this information is coming to the patient in real time. And same thing holds true for the providers. The last thing we want them to do is have distrust in our systems, because at the end of the day, both from a provider standpoint and from a patient standpoint, you're correct. They're not going to look at which system it is creating this alert or triggering this, this methodology or this workflow. They're going to see the system as a whole, that, your health system is, sending me incorrect information, or I can't do my job because the systems don't work. they're not going to know which components. And so really breaking down those silos is such a great point. And I 100%, you need to double down on your governance. The more we do this, the more complicated everything becomes. And so if you do not have a good governance structure, it will only continue to move in siloed work, and it's going to be fragmented. So you need to make sure you're bringing all the key stakeholders together to understand the impact from end to end.
Yes, certainly. Yeah, we had this conversation in the last session as well. So much of AI is data management and data governance. It's all about data, and you've got to have a handle on that data so that, as you say, you're getting the right data, you're using the right data, and you're getting the right outcomes, so that patients, providers can trust what they're seeing from their AI tool. And I don't know if either of you are following The Pit, the HBO Max show right now, but they introduced an ambient AI tool in the last episode, and it produced some wrong data. It added it added something to the medical record that wasn't included when the nurse was entering the information. Just points out the fact that you've got to be very careful about how you manage that data and how you oversee that data. The second point, and Roopa, you'd mentioned this as well, user experience, user design, human-centered design. So important when you're talking about patients. And this is something that we've seen in consumer-facing electronics. They're very hyper-focused on user design and human experience. They want people to use their tools, so they're really focused on that. Healthcare hasn't really done a lot of that up until recently, because now the patient is more of a part of the healthcare journey than in the past, where the doctor had been the center. So as we move forward with AI-enabled patient technology, how it's used, how well patients use it, how comfortable, how easy it is to use, it's going to be all very important to success, to scalability, and to sustainability in all of this. Now, here we go with this third question. I'm going to start with you and Roopa on this one. How are patients using AI right now? And how can you guide them toward using it better or more efficiently or effectively?
Yeah, that's a great question. Patients are already using AI. We can't kid ourselves. It's not just the technologies we put out. They are taking their information, downloading it, uploading it into, Gemini or ChatGPT, and for symptom interpretation or medication questions or treatment comparisons or financial clarity. That's just some examples. And our responsibility is to make sure that they have we have a trusted AI within our environment that they can tap into, which offers guardrails and clinically aligned responses. So that's something that we are looking at. I know there's a lot of open evidence example is one, and there's a lot of companies that are coming up, including some of the EMRs too. And how can we educate the patients on some of the appropriate? I don't think we figured it all out because there's just so much that's getting released, and also design tools that can augment some of the questions that they have, not replace clinician relationships. So thinking about AI that reinforces trust, not create confusion. I think it's an important thing to address. I don't know if we've all figured it out. Of course, we are putting responsible tools within our technology ecosystem that the patients can interact with. But they are going and choosing, and they've always done that in the past, Google search it or other things. And now it's just getting to be more faster with other technologies. So I think being more proactive and how we could enable some of that, I think is an important consideration. But it's changing so fast. I don't think we've kept pace with what external factors are introducing. So that's very much top of our mind, and how can we guide our patients towards using AI more effectively. Now, another aspect to also consider here is demographic. Depending on the demographic, depending on it could mean so many things, right? Everyone has different. Some of them are not using any technology. Some of them are using. I think those are also things that for us to factor in, and really kind of moving with the changes that's happening. So constantly learning, constantly trying to keep up. That's what I would say from our organization perspective.
Yeah. Yeah, the democratization of AI means patients, consumers have as much access to AI as doctors and nurses do right now. There's many tools available to them as there are to the clinicians. And I've had plenty of conversations where a doctor would say he or she dreads the idea of a patient walking in and ChatGPT told me this and recommended this, so something like that. It's a fear that if it's not used thoroughly, that could properly, that there could be some damage done in the long run. Now, Stacey, how? Same question. How do you see patients using AI, and how do you guide them or coach them to make sure they're using it effectively and efficiently?
Sure. Yeah, so it's been around, obviously for a while. When I was a full-time practicing hospitalist, we used to joke around, about the idea of Dr. Google, and that we would have patients always, Googling their results, or so they've had access to data for a while. So us as practicing physicians, you get used to this idea that they're going to come in informed, and it may be properly informed, or there may be some misinformation. And so we have to explain that, this is great that you're advocating for yourself and that you are becoming more informed about your disease or your process or your procedure that's upcoming. And just to remind you, this, we just want to use this to augment, my own personal knowledge as a physician, or, the team's knowledge, and that this is a great way for you to start understanding the disease process. So you can ask us questions, but not to rely solely on these systems, that these are, again, just to augment. The same thing holds true with providers. We are, again, we're not fully autonomous, and we actually have a policy in place for our clinical use cases for appropriate use cases for AI in the clinical areas is about augmenting the workflow. So the ambient AI tools are augmenting your workflow, that they aren't fully autonomous, that you are still, when you sign off on that record, you are saying, I have read this and I agree with this assessment, and so I am putting my name on it. And so I think it's true, we just need to hold true to that as well too in the patient space, is that, we're glad that you're advocating for yourself. We're glad that you're informing yourself. But again, this, there is some misinformation out there. Just, be aware of that when you're reading, the ChatGPT or the Gemini information that's out there.
Yeah. Yeah. And really, the definition now of AI is augmented intelligence rather than artificial intelligence. I think we're moving in that direction, is the understanding that's an aid rather than a replacement. I'm going to stay with you on this one, Stacey. How do you work with your clinicians to support their use of AI with patients?
Yeah, so we are super strong in our ambient. Oracle has a clinical AI agent assistant tool, and that's our ambient listening solution. It's actually built within Oracle, so it's fully automated. Our note-taking time went down from 7.5 minutes to an average of 2.5 minutes per note. And we are actually generating an average of $10,000 more per year per provider because of the use of clinical AI agents. So it's really helping us gather our ROI better, gathering our revenue better, and it's helping the clinicians, document on time, go home on time. The docs are happier, the patients are happier because they're not watching the back of a doctor who's, staring at a computer. So, but that being said, we need to ensure that we are supporting the physicians that are using AI to support the patient. So what does that mean? Our initial approach was to deploy using minimal training with the understanding that it's another tool. People are used to these digital tools, these digital agents. But when we realized we actually did a kind of a time and motion study. And for those that had a deeper training, actually were much better performers, had more notes produced and a quicker turnaround time. So we ended up doubling down on our training for use of AI agents. We also have a literacy program that we built out. So an AI literacy program that's actually part of our computer-based training modules that are part of our yearly assessments and review for all team members, especially management. And then we also have in place a strong consent form where we call out the use of AI to augment care. And again, we're not, at least at Beacon at this point in time, on the clinical side, revenue cycle, a whole different story in terms of, automating, scheduling, that kind of thing, fully autonomous in some of those areas. But on the clinical side, we're still in the human in the loop approach. And so we need to make sure that they have the right tools, that they have the right consent forms, and that they have the right training. And then building on top of that, making sure that they understand how to speak to patients with AI. That's something that you have to learn, that you can't just kind of talk the way you used to talk. Again, in my mind, I know how I document a note template, but if you speak the way you document a note template, the patient is going to say, what in the heck are you saying to me? And so it's about verbalizing your physical exam in such a way that's meaningful to the patient, but is actually able to be captured, with the use of a clinical AI assistant.
Yeah. A key element as we move into the way your nurses use AI, I think, ambient listening especially, is that nurses do. They don't necessarily talk, they do. And it's a different way, as you say, to speak what you're doing or to speak to the patient about what you're doing rather than just doing it. It's certainly with ambient. But the idea, too, you had mentioned AI literacy, the idea that clinicians know the right words, to talk to an AI agent, what to say. The idea that a patient consumer talks to ChatGPT, explains his or her symptoms, might be using the wrong words to explain those symptoms. And as a result, we'll get the wrong result. We'll get the wrong diagnosis or treatment recommendation. Right. There's been some studies about that recently. There's a real concern that it's negatively affecting patients. Roopa, same question. How do you work with your clinicians to support their use of AI with patients? How do you talk about AI literacy?
Yeah, a big part of what we do is we, definitely involve clinicians and clinical leaders early in any of our implementation or use case design, and pilot tools in controlled environments. So we try to learn from the experience before we decide to scale up. And part of that is providing transparency in how the AI models function, establishing governance around validation and monitoring. So it's pretty much, for most tools, any tools that even if it's something we want to test out. So it's always a very interdisciplinary approach in how we, take it. So along with that, AI literacy is kind of, baked into that, as part of our pilot or as part of our, large scale deployment. It just becomes part of, one of the spokes in the hub approach. And we, of course, we frame any of the AI as a decision support. It's a human in the loop. It is never a decision replacement, right? For clinicians, that's absolutely, agree to what Dr. Johnston had also, mentioned. We, also part of this is continuous feedback, ensuring that we are, we're keeping up. From a technology standpoint, of course, ambient listening has been a huge hit. It's just saving time for a lot of our clinicians. And a part of that is, when the patients are coming in, of course, from a compliance standpoint and regulation standpoint, making them aware that an ambient tool is getting used. Every time that, there's an encounter with the patient, getting their signature on that. And in some cases, we've had patients say that they're not comfortable and, not turning that on. We've also kind of helped further with our clinicians in some of besides the ambient listening, this is more in some of our acute care settings in the hospitals, where we're also enabling automatic progress notes creation, trying to help, the nursing as well as other besides the physicians. That's something. And another area that we are also testing out right now is the whole cycle down to revenue. The whole connectivity down to revenue cycle, where physicians and clinicians are focused more at the point of care, what needs to happen right at that point, and then the clinical documentation integrity team or revenue cycle is after the fact. How can how can we help our physicians so that they don't have these constant CDI queries and other things upfront, even as the documentation is happening, helping them and nudging them along with some of the downstream things so that they're not distracted and queries coming in later on. So those are all things, just trying to see how we can improve their experience more upstream, and not distracting them even from some of the other things that happen in your typical life cycle, from an administration standpoint. Other aspects, we are also more supporting primary care. Primary care is kind of the linchpin for a lot of referrals and other things that happen to patients. They've just been inundated with so much, right? Over the last year, we know the burnout, is so true, especially in the primary care setting. So putting a lot of technologies there. One example that comes to my mind is digital diagnostics is a vendor where, if a patient's diabetic right there in the setting, they have, an image taken and an AI that detects if there's, referral needed for, because from an eyesight standpoint, even neurology referrals right there. How can we, if it's not the right referral, there are AI tools that we are implementing. Is this really a migraine? Should it be, a neurology consult versus, even on the cancer side, there are so many things that, some of them could just be as simple as a questionnaire. Should the patient need, genetic testing, cancer or heart failure? So we are embedding up more and more AI based technologies in the primary care setting, so that we are more proactive early on and also supporting our primary care. We all know that access to specialists is so hard. So what is the referrals that really need to go to the specialists, and kind of enabling the decision support through AI tools, there's a lot of things that we are working on that side as well.
Yeah, this is decision support for patients as much as it is for providers. They're both AI as a tool for both of them to improve the experience. Your mention of revenue cycle management is interesting because we have a mastermind program in revenue cycle technology, and a lot of the interesting ideas there for the use of AI is that helping rev cycle managers talk to patients ahead of time about what they're going to owe, their insurance, helping guide them before they even enter the hospital to make sure that they're not hit with a bill at the end they didn't expect or anything like that. Managing patient payment expectations, AI has that opportunity, and there's another use for AI in the patient place. Now, Roopa, I'm going to stay with you on this one. Here we go. One of my popular favorite topics, and it's something we probably will be looking more towards in the future than right now, is how do you think AI can be used to enhance care management outside the hospital? When we can talk about hospital at home or remote patient monitoring or whatever, but more services are going to be pushed to the outside of the hospital. How do you think AI will have a part in improving those services or in facilitating those services?
Yeah, I mean, this is an excellent question. I know most of the patients, they prefer not to stay in the hospital, right? We all are more comfortable staying in our homes and getting excellent care. And it's definitely one of the most promising areas, I think. And as you said, OSF also has had, one of the first hospital systems in Illinois to have a hospital at home program. Of course, we have that plus, remote patient monitoring, programs. Not just chronic disease, but even patients that are getting discharged, post-surgery, continuing to monitor them. And all of these aspects have some type of a decision support or AI embedded in them to help the care teams on the other side. And most of this it's not just a technology, implementation. There's always an OSF's grounding principle is there's always a connectivity to a person on the other end. All of these technologies, the patient can always connect to someone on the other end. is because that's so important, right?
Yes.
And the other areas in care management is navigation for and support for cancer and complex care, right? So one of the areas that our digital health umbrella has is digital navigators, digital health navigators. And it's whether it's cancer navigators, whether it's patients that are chronic disease and social determinants, kind of helping them connect them to navigators digitally, and which also has signals that prioritize and escalates who needs to have the who they need to call, who they need to have a conversation. A lot of automations too in terms of workflow. One example that comes to mind is compliance. We had a lot of patients coming in for colonoscopy, and but a lot of cancellations happening because before the colonoscopy, you have to stop certain meds, and you have to there's a lot of preparation that happens. And that's a place where it's not just automation, but we had our user experience designers actually simplify how we connect with our patients with more visuals that coach them along. Hey, did you stop this 2 days before, 3 days before, a week before? So I think there's a lot of opportunities there in patient education, either post or pre care, from a care management standpoint. And also generating insights from our unstructured data that helps our call center as well as our care coordination teams, right? The teams on the other end. And of course, risk stratification and all of that has always been there. But we are leveraging all of that to prioritize, to connect them to the right programs. Before, it would have been a person, looking up charts and then enrolling them into programs. It's still a human in the loop, but we are kind of, increasing their productivity and reducing the, burden on, looking at data and other things by, helping our clinicians on this side as well to connect to the patients that might need, any type of care from their home.
Yeah, definitely. I had neglected to mention, I usually do at the half hour mark. We're half hour and we got a half hour left, and send in your Q&As. We are at the 41-minute mark. We're just breezing through this conversation right here. And as with the last one, we could talk about this all day, but I just want to remind our viewers that we will have some Q&As in the next 10, 15 minutes or so. And if you have any questions you want to ask, please submit them in the Q&A box. I know we've got at least one in there right now. Stacey, same question. The idea of moving care out of the hospital into the home is fairly popular right now, fairly topical as well. And the idea that AI may enhance that or help that or improve that. And
Sure.
as Roopa mentioned, not just moving care, but pre-care, post-care, everything involved with that. How do you see AI playing a part in that? And how do you see Beacon Health doing something with that?
Yeah, so I think we're going to have essentially two approaches to this. So one, I'll start with the kind of the easier to understand and easier to implement, is using AI as essentially a digital employee. And so making those calls, whether it's a follow-up call to the case management call to ensure that they got their medications filled. So we are looking at partners that would be doing that, where it's an AI agent actually making the calls on behalf of Beacon. Also calls for pre-admission testing to ensure that all of the work is being done in a timely fashion. So there are several instances where we can use an AI associate to make these calls, and then reducing the burden on our team members, so reducing the calls from the nurses or from the care management team. So that's one thing we are definitely in the process of vetting right now. That being said, I look at the broader idea of precision medicine. And so bringing in all of that data, and this is really where clean data makes a lot of, is so critical to our long-term success. So you've got your genomics data, you've got the Internet of Teams, so there are, things, so all the wearables that their glucometers, blood pressure, vital signs, cameras now are being installed into home-based care homes, for falls. And so, so you've got your cameras, you've got all of the IoT coming in, you've got your data and analytics from your core systems, you've got the social determinants of health. So now we have all this data. Oh, care gaps. So don't forget about care gap closures. So now we've got all of this data. And wouldn't it be great if we could use our core systems, use our data warehousing systems, layer AI on top of that to say, Mrs. Smith, she has these parameters in place. We need to move up her appointment from 3 months to next month. And then while she's there, let's screen for these things. Also talk to her about her food insecurity, and then couple that with, getting her slated and, meeting with someone to help with her food insecurity. So looking at all the things that contribute to health and start focusing on keeping people out of the hospital by being more predictive and prescriptive with our care, and really starting to focus on increasing their wellness. So really trying to promote shifting our care models. Again, that's kind of pipe dream, the pipe dream of where I think we can be. It's going to take us a couple of years to get there, but we are starting to have those conversations of what that could mean, and where our partners play a big role. So what can Oracle do for us? And then if Oracle doesn't have that, which additional partners do we need to lay on top of that for frameworks? We've done some really great work with care gap closures with Magical and Cologuard. And in that case, actually, it is fully autonomous. So we do have an instance where if someone's recommended to get a Cologuard, the order automatically is triggered within the EHR through our use of a Magical AI agent that was built specifically for Beacon. So anyway, so there are instances where we're starting to do some of these things, but I think my vision of what it's going to be is going to take us a few years to get there.
Well, that's what I want to hear. I want to hear the ideas, the potentials, and certainly it's the idea of the smart home. The smart home concept has been so much fun to follow over the last few years as AI is introduced. CES in January out in Vegas always has an entire pavilion dedicated to smart home concepts, and AI is everywhere there. And it's more and more there are healthcare applications in there. I mean, you're talking everything in the home that's wired and censored and so on and so forth, so that a person at home can tell, or a healthcare provider in the hospital can tell how much sleep you're getting, how much movement you're getting through your house, what you're eating, when you're going to the bathroom, everything involved in that now. There's an AI element to that. And the idea that can play a part in care management, in health and wellness is certainly, yes, it's on the horizon. Some of it's being done now. There are some very interesting smart tools out there, but as health systems and hospitals get more invested in this area, it's going to be exciting. And yeah, it's going to take a little while too. Stacey, I'm going to stay with you on this one. And understanding we're about 13 minutes left in the hour. It's going fast. This is something we really need to talk about to kind of finish things off. Is how do you measure the value of your AI tools for patient engagement? What are the specifics you look for to know that this particular AI tool is working?
Yeah, I think that's a great question. So, so this is where that governance process really comes into play. So we stood up an AI advisory council, and it reports into the IS governance councils altogether. It's one of their advisory council levels, and it's kind of the seal of approval, meaning it has compliance, it has ethics, it has clinicians, operators, and patient experience folks on that council. And then in that council, we review the vendor. The vendor completes a vendor intake form for bias. Where is their data stored? So kind of like a security risk assessment, but we have it basically an AI risk assessment tool that we've created that the vendor must fill out. So those are the first steps. And then once it clears that hurdle, we then put together a pro forma to say, here's the anticipated ROI from this particular tool. If there is no ROI, we are not approving AI at this point in time. Now, I know there's going to be some softer ROI tools that, really focusing on the end user experience. So if we're passionate about a tool that has no set ROI, then we do take it to the executive steering committee to say, okay, there's no defined ROI on this, but we really believe that this is going to give back time to our clinicians or enhance the nursing experience, and we want to increase our nursing retention. So then we might approve at that executive level something that doesn't have a defined ROI. So once it gets through the approval process, what we have then is I have a director of AI and transformational technology, and his job is really to kind of monitor AI usage, governance, and then also take it through from implementation all the way to adoption and optimization and maintenance. So he'll keep those AI projects under his purview for 2 years. And at 1 year, we're going to look back for, is it meeting the ROI? And if not, why not? Then we look at the adoption rates, the training programs. Do we need to double down on, reevaluating the workflow, reevaluating our policies, or, again, increasing the training? So assuming it makes it through that first year, and then we look back at 2 years, and then the 2-year mark is, did it realize the ROI that we anticipated? If it did, then we keep the system and then we move it into, just regular operations, the IS team or what other department would be responsible for maintaining that system and kind of their normal operations. If it does not, at that 2-year mark, meet the ROI, then we have the difficult decision of, are we keeping this system in place or not? It didn't meet the defined ROI. Are we not using it? And if not, then we need to learn how to turn things off. Systems are not great with turning things off. And that's where it's really a challenge for us. And we have to be strict and firm with it and saying that if we're not meeting the ROI, we need to feel comfortable with saying we're no longer going to use this tool anymore.
Now, part of that process is identifying or defining ROI. It sounds to me that a lot of ROI is financial.
At least at Beacon right now, we are. We work closely with the finance team and trying to define the use case. So again, what problem are you trying to solve? And so if you have a predefined use case where you say, we are going to increase our number of surgeries because of XYZ, or we're going to decrease our number of denials because of XYZ. So did you do what you said you were intending to do through the use of this tool? And then working closely with the finance team and putting together pro forma, that's one thing that we are being very strict on.
Do you feel that AI is helping you to redefine AI? I mean, you mentioned stress and burnout as a factor. It's not necessarily ROI. It is a soft ROI to a tool.
And we have had some come through that get approved. Again, more around the clinical end user experience, on focusing on ensuring that we have that great end user experience. The clinical AI agent was a perfect example. We approved that because we were trying to give back time to the clinicians, to the physicians. But what we didn't realize is we tracked it, and a year later, we were actually making a little bit more money from each of those providers that was using the system, which was a great win. But that's not why we did it. But if we're going to spend money without that predetermined ROI, I need the executives. So I need ELT to sign off that, yes, we believe this is important to spend our money on, regardless of whether there's a significant ROI or not.
Okay. Roopa, same question. How are you measuring ROI with patient-facing AI tools?
This is a great question, and it's also, it seems simple, but it's also a little bit, I would say complicated. So, of course, as Stacey mentioned, we have a similar structure, where we have a governance team. It's not just AI, but what we call as transformation executive committee. So that's where, whether inbuilt products or, solutions that we are bringing from external or internal, and for pilot, part of that is ROI. The ROI could be operational, reduced call volume, increased productivity, improved scheduling efficiency, your clinical outcomes, your typical ones, readmissions, infections, improved safety, closing care gaps, experience, right? Because you're talking about patient-facing tools. What does our engagement rates look like? What is the interaction? So those are all things that we measure. time to resolution, patient satisfaction, of course. So besides that, and of course, financial rhythm, working closely with a financial analyst, and what does it translate into? Some of this into financial, and some of them might not, exactly translate. There is also a long-term digital capability building of some of this. Stacey mentioned in the previous questions, the previous question about building that data infrastructure, genomics, your IoT, your imaging, and bringing all of this together. That's also an aspect that we are. That's a capability building, right? That doesn't have an ROI immediately. So there is a strategic aspect which includes platform scalability, data liquidity for future innovation, and also future reduction and rework across systems. So some of that is the ROI is more long drawn out because it's really about capability building that enables the AI. So I think it's definitely a combination. Most of it, of course, your traditional ROI, but there's also aspect where we are building some of the capability that we know it's a longer runway, but it's going to be very critical to enable, all the aspects. One of the things that we've been building, in building our capability of data warehouse and, integrating our data hub where we are starting to bring in omics, we're starting to bring in other data and get that bigger picture about the patient, right? Social determinants, care gaps, other aspects that's proactive, that's got a longer runway. So, that's how our organization looks at it. It's a balancing act, definitely have an ROI for most of it immediately, but also know that some of this is more long-term capability building that needs to be put in place.
Yeah, certainly. There, excuse me, there are two ways of looking at it. Certainly, immediate ROI, which certainly your CFO would like to see, and some of the long-term aspects. And this is where clinical outcomes comes into play too. It takes a few years to really gather the data you need to make sure that to know if this is working or not. I know we're talking about clinical outcomes for a lot of this. We are now got about 4 minutes left in the hour. Excuse me. And I put up questions here. We did have a few questions come into the Q&A. I kind of want to end this with one more question to the both of you. Stacey, you talked about it a little bit at the beginning or earlier on about the potential for AI in this area, in patient engagement. And I want to ask you both, and I'm going to start with you, Roopa, on this, is what is the biggest tool on the horizon, or what is the next big thing that you're going to use AI for that directly affects the patient engagement? What's the next technology, service, or whatever that AI is really going to make better for the patient?
I think it was, Stacey mentioned that it's the really next big thing is more getting into more autonomous, right? How do we, from a patient engagement standpoint, still, having a connectivity to somebody on the other end. So I think there's so much opportunities there that we can reduce the burden on our care teams. Of course, it goes with, agentic AI. Those are things that are getting deployed, but I think there's, so much in every area in the longitudinal journey and the patient experience side that we can, deploy. Some of this is also the safety aspect and, piloting and testing. But I think the next big thing is getting into the autonomous aspect, whether it's experience, whether it's proactive connections to our patients, whether it's pre or post. I think that's going to be a big aspect, and a lot of disruptors are already coming into play here. So I think it can definitely reduce increase value for patients at the same time, patients and consumers at the same time. Also really have clinicians who went to school really work for what they do what they really love doing, right? I think that's the big thing from my viewpoint.
Okay. I like that. Good. Stacey, you get the last word here.
Yeah, so for me, when I think of what the patients really want, they want access. They want information now. They want to be able to schedule an appointment tomorrow, but maybe I want to schedule an appointment a year from now when I know I have the week off. And so they want to be able to schedule appointments late at night because I don't have childcare during the day. So I think really doubling down on thinking about what your patients want and thinking about it in that personalized, precision experience. And so, knowing what that individual wants. And so that patient wants a digital experience. And I want all virtual appointments because that's just who I am. I like talking to the doctor on the phone. I don't want to come in. I don't want to sit in an office. But then I've got another patient experience that I like to talk to my doctor. That gives me a chance for FaceTime. And so really understanding what each individual patient or consumer needs, and then putting that up on a platter for them so it's seamless for them to get in when, at the right care, the right provider at the right time when that particular patient wants it. And so it's going to require operational buy-in, it's going to require clinical buy-in, it's going to require standardization, and then layering on top of that is all of the AI that we can throw at that to make it a more seamless experience for that patient.
I like that. Thank you. Perfect answers, both of you. I like the world that we've created here for healthcare and how AI is going to influence it in the future. That is all the time we have for questions today. That's our hour. And as I said, we could continue talking about this for the rest of the day. I want to thank the two of you, Roopa and Stacey, again for a wonderful conversation. And I want to thank our audience for taking part today in AI Now, both the last panel and this panel. We've had two very good panels today. Over the past couple hours, we've heard from healthcare experts about key strategies and tactics for tackling the future needs of healthcare organizations, especially here, and as well as making sure you are set up for future success in these areas. We look forward to seeing you again for future Health Leaders webinars and events. This concludes the Health Leaders AI Now online summit. Thank you very much.
Thank you, Eric.